The surgeon's story, the patient who woke up smiling. I've performed hundreds of surgeries over the years. Most of them blend into each other. A new case, a new challenge, but there are a few patients, a few moments, that stay with you. Not because of the complexity, not because of the textbook difficulty, but because they remind you why you became a surgeon in the first place. This is the story of one such patient. It was an ordinary afternoon. I was wrapping up rounds when the ER called. A young woman, late 20s, had been rushed in with severe abdominal pain, low blood pressure, rapid pulse. Pale, sweating, barely conscious. She had just been married 6 months ago. A bright smile in her photo ID, but that day, her face was etched with fear and agony. Initial scans revealed something alarming: she had a ruptured ectopic pregnancy. Internal bleeding, life-threatening. Time wasn't on our side. I walked into the waiting area to meet her husband. Young man, probably no older than her, pacing, eyes wide with panic. I explained it to him straight: she was bleeding internally, she'd lost a lot of blood. The only option was immediate surgery. There were risks, but waiting wasn't an option. I could see him struggling to process it, swallowing hard, holding back tears. Finally, he just said, "Do whatever it takes. Please save her." That sentence, it echoes every time a family puts their trust in us. We rushed her to the OR. The team was already prepped: anesthetist, nurses, assistants, everyone moving like clockwork. As soon as we opened her up, we could see the severity. The ruptured tube had caused massive bleeding. Suction, cautery, clamps, each second mattered. There was a tense moment. Her blood pressure dipped dangerously low. I remember glancing at the monitor, then at my assistant. The entire room held its breath. But this is where training, instinct, and teamwork come in. We controlled the bleed, removed the damaged tissue, transfused blood. Slowly, her vitals stabilized. After over an hour, we closed up. Exhaled. Another life pulled back from the edge. The next morning, I went to check on her in the ICU. She was groggy but awake. I approached her bedside, expecting the usual questions: what happened, or when can I go home? Instead, she looked at me and smiled. A soft, tired smile. And she whispered, "Thank you, doctor. I thought I wouldn't see another sunrise." That moment hit me harder than any complication or diagnosis ever could. We, as surgeons, are trained to focus on precision, technique, decisions made in seconds. But what we're really holding in our hands isn't just tissue or blood vessels. It's someone's future. Someone's dreams, their family, their story. That young woman walked out of the hospital a few days later. I moved on to other cases, other emergencies. But that smile stayed with me. Because that day, I realized, we don't just save lives. We save moments. We give people back to their loved ones. Not every surgery has a happy ending. We face loss too. But it's stories like hers that remind me of the privilege and responsibility of this profession. So, the next time you meet a surgeon, remember, behind every scar we stitch closed, there's a story. And sometimes, the simplest thank you is what stays with us the longest.